Rutherford Issues with Bryan Barrett on FM 101.9 and AM 1450 Murfreesboro, FM 100.5 Smyrna. Listen and watch at WGNSradio.com.
Rutherford Issues is powered by Middle Tennessee Electric. Manage your count, power, energy use. You can do all of that with the MyMTE app. Pay your bill, report outages, all right there from the app. Download on iOS and Android. Our conversation today centers around the Child Advocacy Center, and Presley Hosford joins us this morning, along with Jessica Wauchek. And Krista has lost her voice.
Yeah, yes. We don't know the details, but I think she partied a little too hard this weekend.
It has to be something. I'm not sure, but that has to be, like for her, that has to be like torturous.
Oh, yeah. She said it's never happened before, so it was a shock. And she's learning to be quiet today, she said.
It's going to be a hard lesson.
Oh, yeah, definitely.
Isn't that the truth? So, but good to have everybody here and the Child Advocacy Center. I don't ask this every time, and I shouldn't assume that everyone listening, Jessica, understands what the Child Advocacy Center does. We have so many new people that come into our community, Yes, I think maybe some people don't understand the work of the CAC. So when you get that question asked to you, what do you say?
I say we're an amazing group of people who we as a team respond to allegations of child abuse, child sexual abuse, and drug-endangered children. Our team is the Child Advocacy Center, along with Department of Children's Services, law enforcement, the District Attorney's Office. And once that allegation comes through DCS, we activate the team and we respond. The CAC performs a forensic interview that is utilized in the investigation of the case. While that's happening through our forensic interviewers, we also have fantastic family advocates that help the family, stand by them throughout the whole process, and let them know what they expect, and just be that support system that they may not have. Am I missing anything?
No, I think that's it.
And then we have Presley. What she does is she tries to put us out of a business or out of work every day by trying to teach prevention, which I'm happy about.
Yes.
She does the Darkness to Light training to adults to learn how to prevent your child from being child sexually abused, mm-hmm. and from abuse, and how to report and how to react when someone tells you they are being abused. And we are actually going to be kicking off a new program in July, actually.
Oh, yeah?
Yes. And right now our training goes directly to adults because it is an adult's responsibility to take care of our kids. We raise them and we should protect them. But now we're going to have a new hire that is going to be working directly with children at their homes and just teaching them safety around abuse and boundaries and things of that nature.
Yeah, it's called SUBS for short, but it's the Speak Up, Be Safe program, and it is that child-based prevention program to help them recognize safe adults, learn their body and boundaries, and help them identify risk as well, and also play a part in preventing any abuse from occurring. But of course, it still is an adult's responsibility, but this helps just continue that conversation and keeping our community safe where children can grow up happy, healthy, and loved.
Yeah. So where do we envision this being done? Is it kind of like what you do with Darkness to Light, just on a child's level, or?
Yeah, pretty much. The only difference is this will be home-based. So going to a home and really a lot of one-on-ones with children, especially because the program is divided up for age-appropriate lessons. So you can't have a group of 5-year-olds and 14-year-olds. It's completely different lessons with age-appropriate language and different examples of body safety and terminology. And so we think this would just be better in a one-on-one or smaller group, maybe siblings who are closer in age, since the lessons will differ with groups.
Interesting.
Mm-hmm.
So I know this is all very new. Has this been done somewhere else?
Not with us. So we'll be learning as we go for sure.
I think they have started this program up in Knoxville. We just got the grant funding to try to start the program beginning in July. So we're learning. We're going to learn how it goes. But if anyone is interested, in having one of our social workers come out and do this with their children,
Yes.
because like she says, it's a taboo topic, and a lot of parents don't like to have that conversation. So sometimes talking to the parents and maybe also talking with the child can probably just facilitate this. And they could just call our office, 867-9000.
Yes, and we can help get that ball rolling because these are awkward and hard conversations to have, and we want to make it a bit easier.
I would think that, in a school setting to like fourth graders, that would be maybe difficult, and not everybody would want that conversation, parents and things.
Exactly. And what I'm anticipating is that feedback, like that open conversation. When it's a one-on-one, they'll probably feel more comfortable in asking the uncomfortable questions.
Yes, or even making a disclosure to their provider of this training, I think will be more helpful instead of a big setting.
Right.
Building that trust with that kiddo.
Well, that's something brand new. I mean, it's not like you haven't been here for over almost 2.5 decades. But
almost, yeah.
but also still trying to do things new. But this is the 25th anniversary year, right? 2025.
Yes, we're 25. Is this the silver?
I think it's
silver, right?
Yeah.
I don't know, but I'm not sure. Yes, it's our 25th year, and we're going to be celebrating. The chamber is hosting an event with us on August 11th from 4 to 5:30. It's a Monday, and we're just going to have some appetizers and some drinks, and maybe I'm trying to see if Publix could give us a big 25 cupcake cake.
Yes, beautiful.
But if you want to come on and join us, it's a free event, and we're just celebrating being in the community for 25 years.
Yes, and I think to get to know our staff too, because we have such a wonderful staff who's so passionate with the work we do. So we'd love to meet you and tell you a little bit more about our mission as well.
And a growing staff, apparently.
Yes. So we currently we serve 2 counties, Rutherford and Cannon. So we have 13 on staff right now. And beginning July, we'll have 13 and a half.
Yeah.
13 and a half. We're going to hire a part-timer just to help us with that subs program.
Yeah. Awesome. You almost have 120 square feet per person.
Almost.
In your current office.
Almost.
We're a little crammed in our current office space. Yes, we are. We take I guess our morning meetings is our saving grace a little bit, because we know when we serve about 5 children a day of forensic interviews, so we all have to take turns and to see who's going to be in the office. I know that when there's a lot of interviews, I'm not allowed because I'm very loud. So I have to be loud somewhere else.
Yeah.
That's why they sent me to the radio.
Oh, okay.
So
but today you have to go somewhere else.
Yes, today we just got to go somewhere else today. But yes, it's a very tight space, and hopefully soon we'll be able to relocate to our own facility, a new facility. Yeah,
well, that's kind of the hope. I understand that there. I guess this came from Rutherford County government, right? $1 million.
Yes, they have earmarked $1 million for our initiative to be able to purchase a building. Obviously, the building is not going to cost $1 million, but they will be contributing towards a new facility for us that will give us a more opportunity to expand. It's like you said, we're up here almost 2 decades and a half, and we're still trying to find new ways how to reach our community and to provide prevention. With the new facility, hopefully we will be able to expand into mental health, and we also have a partnership that may happen if we do get a new facility with Our Kids in Nashville that provides forensic medical, so by getting a new facility and more space, we'll be able to, not only do more forensic interviews, but we could also provide more services.
So more space, what would be, what is the desire? What would be perfect?
I think
amount?
The goal is between 8,000 to 10,000 feet.
Square
feet, yes. 8 to 10,000 is what we would love, but at this point, we're just seeing what we could get.
And especially too, we look at the prevention and fundraising side of everything. It's hard for us to go into an office when a child is talking about the worst thing that has ever happened to them, and we're in the background making cold calls. And Chris and I, we work together so well, but we share a desk right now, and so we would love to be able to spread out and be in the office without feeling like we are disrupting such a vulnerable process.
Yeah. Currently, have about 1,800 square feet, I think, something like that.
I think it's a little bit less than that.
I think it's like close to 14 to 16.
Yeah, 14 to 16
really?
square feet, yes. Yeah.
Well, just...
The bulk of it is a waiting room.
Yes.
So I'm happy the family has the
family has space.
The family has a good space, but the staff does not.
It's, if I'm not mistaken, isn't it kind of like a converted doctor's office?
Yes, it is. We are right adjacent to Dr. Gardner's office. So yeah, it is. Looks just like a doctor's office with one evaluation room, I guess.
Yes.
Well, two evaluations that we made into the forensic and room and the observation room.
Yes, but yeah, having a bigger space will just help us work better with our families as well, especially in these summer months. If we have one family in the waiting room, they have to wait in the parking lot, because we want to keep that confidentiality. And so we're hoping to, with a bigger space, we can accommodate our families much better.
Yeah, because some people show up early for their appointment. Like I know I do.
Sure.
People just like 15 minutes early. So when they come in and if the last appointment is not done, they have to wait outside. So just having that additional waiting room, to keep them separated and have their confidentiality, that'll be amazing.
Well, and if you're doing 5 of those a day on average,
we get a lot of overlap, and we have to tell them, like, we're gonna have somebody out and get you. If you don't mind, just.
And then, I mean, just the daily work of 13 and a half people,
Yes. Like I said, sometimes you can't come in. I'm like, okay, all right, let's go to Brasshorn.
Yeah, exactly.
I'll work from there. They got Wi-Fi.
And it's not Jessica's fault. She makes us laugh so hard too, but we never.
I'm the social worker for the social workers.
Yeah, she is.
Well, that's awesome. So hopefully things will move along in a progression. Because, I mean, you're talking about, 7 times more of the space that you need?
Right. Well, before, we were in a 4,000 square foot place, and we did have enough room for interns, because that's another thing. It's like we do have interns. We host about 3 to 4 interns a semester. And they're a great that's a great program, and we love to have them because they help us tremendously, so we don't really have a place for them to stay either. But when we used to be at the old fire hall out in Samsonite, we did have that extra space that we were able to put everybody in the back, So we just didn't know how to. We thought we could do it. I guess COVID helped a lot.
Yeah.
COVID helped a lot because COVID taught us how to work independently, like at home sometimes, but
helped us transition.
Yeah, it helped us transition to a smaller space. But we just have a lot more children. Like you said before, Rutherford County is growing tremendously, so we have a lot more cases coming in. And we do have a Spanish-speaking forensic interviewer. So we also get a lot of courtesies of interviews from other counties, so we're just in demand right now. So.
Well, hopefully, celebrate your 25th birthday and something big will open up.
I hope so.
The best gift
That would be
ever.
the best gift ever. Like, just come in with keys. This is your building. Go ahead.
And I assume that if someone's listening that, has
a piece
8
of
to
property.
10,000 square feet open right now or that, but I'm sure you'd like to have, this is our permanent home kind of situation.
Yes, exactly.
Sure.
That's exactly it. It's we appreciate the county, we appreciate the city, and Dr. Garner is also giving us an amazing rate at the current location, but at the same time, it's like we just want something to call the CACs,
Yes, definitely, and we're so supportive for all the continuous support we get through the years. I mean, 25 years, and people have just been so amazing to us, and we're so grateful. But we want to keep growing. For sure, so we can continue to serve the community to the best of our abilities.
Let's talk about briefly Internet Safety Month. Is that the month of June? Okay.
Yes, it is. So sorry to get a little depressing. But, we are seeing that 1 in 9 youth are experiencing online sexual exploitation. And especially during these summer months, kids are home more. They're on their laptops and tablets and phones more. And as parents, as guardians, we want to make sure that we are that first line of defense when it comes to digital safety and protecting our children from online groomers and online perpetrators. And I sound like a broken record, but communication truly is key. You want to talk to them about the apps they're using, the websites they're on. Do you know if their privacy settings are on? Is anyone able to message them? Does your child feel comfortable coming to you if someone they don't know has reached out to them online? And I want people to be aware of the resources that are out there as well that help get the ball rolling on these conversations around online safety. One of my favorites is NCMEC, which stands for National Center for Missing and Exploited Children. They have something called NetSmart, and it's educational videos for elementary, middle school, high school. They break it down by age of how children can stay safe online and detect online dangers. For older kiddos, for teens, there's resources for parents on how to talk to your teenager about sexting or cyberbullying. And so I really encourage, if you're not sure where to start or how to have these conversations with your kiddo, check out that resource and lean on it. It's great.
Okay, awesome. Internet Safety Month here in June, and I guess just a brief 30 seconds, but, mark your calendars, save the date, light up the night.
Oh, yes. September 12th at Oakland's Mansion. It's our end-of-year party just to celebrate all the hard work our team does. So we'd love for you to come out, wear white, play some casino games.
Casino night is back.
All right.
Casinos are back. Yeah.
And we have some fabulous silent auction items already. So come spend your evening with us. We'd love to see you.
Our friends from the Child Advocacy Center joining today, and Presley, Hosford, Jessica Wauchek. That's it for the show. Hope you'll tune in next time for another edition.